Welcome, BPHE colleagues, to our documentary on rotator cuff and shoulder maintenance. Today we will talk about this common shoulder injury as well as how we can prevent it. Rotator cuff injuries are commonly associated with activities that involve repetitive overhead motions or excessive stress on the shoulder joint. Some of the movements in sports that frequently lead to rotator cuff injuries include throwing in baseball or softball, the swinging motion in volleyball, and swimming. Any overhead press, bench press, and lifting heavy weights without proper form can strain the rotator cuff muscles and potentially lead to injury. Let's look at the anatomy. The rotator cuff is comprised of four muscles which originate around our scapula or shoulder blade and attach to our humerus or upper arm. These are the subscapularis, infraspinatus, supraspinatus, and teres minor. Together, they are responsible for protecting and providing dynamic stability to the shoulder joint, while individually they each have their own role. The subscapularis is primarily responsible for internal rotation of the shoulder. Infraspinatus and teres minor are primarily responsible for external rotation of the shoulder. And the supraspinatus mostly helps control the shoulder joint during abduction, but can also assist in external rotation. While these muscles are associated with rotation-based movement, they're actually activated quite well in other shoulder movements as well. So now let's get into the exercises. First, external rotation with a resisted band. This will help strengthen muscles in the shoulder joint responsible for external rotation, such as the infraspinatus and the teres minor. Next, internal rotation. This will strengthen the subscapularis muscle and improve shoulder joint stability. Lastly, stretching the chest and lat muscles, as the tightness in these larger muscles can exert tension on the rotator cuff. In summary, by performing external and internal rotations with a resisted band and by stretching the chest and lat muscles, we can strengthen the muscles in the rotator cuff, improve joint stability, and prevent this common injury from occurring.